Well, can India handle the coronavirus outbreak? Data shows that we are lagging far behind when it comes to preparedness. Now, India has 1,500 lung doctors, while we are in the need of 23,000 such specialists. The country currently has 22,000 anesthesiologists, while there is a need for a whopping 1.5 lakh such specialists. Coming to testing, India has about 72 diagnostic labs. With a population of 1.3 billion, the country is testing 90 samples daily. Now compare that to South Korea, which is carrying out 12,000 tests in a day. In fact, South Korea's daily testing rate is higher than India's total tests. Let's also compare India's testing rates with some of the other countries. With over 6 tests per million people, India has one of the lowest testing rates in the world. Italy, which is the worst hit nation outside China, is testing over 1,400 per million people. China is testing 2,800 people per million. South Korea and Bahrain are testing the maximum number of people. Now, this is the time for housing societies across India to step up and help their residents. We are going to tell you what must be done if someone in your society or in your building or in your family tests positive for COVID-19. Let's start with the housing societies. Well, they must organize more and more sanitation drives and ensure that public places are regularly disinfected. No kind of public events must be organized at this point. Birthday parties, annual celebrations are a strict no. Gyms, swimming pools, community centers must be shut down immediately if they already aren't, and if there are any suspected cases, they must be flagged immediately. Societies are urged to send daily single-line reports on suspected cases. If people refuse to isolate themselves despite showing symptoms, don't hesitate to call authorities. And most importantly, ensure that there is no panic. Now, what if someone in your building tests positive? The government will then place your society and a further 1 kilometer radius under medical surveillance. The immediate contacts and the support staff will be tested and quarantined. People in nearby houses will be surveyed for symptoms. Make sure that you cooperate with the authorities and reveal all details. Slight oversight could end up being costly, while everyone in the building will be constantly observed. All of them will not be quarantined. Now, what if someone in your family itself tests positive? Here's what will happen. First, the immediate family will be tested for COVID-19 and placed under quarantine at home. No kind of outside contact will be permitted. This in-home quarantine will go on for 14 days. If the family also tests positive, they will be taken to a quarantine facility where they will receive treatment.